Hey everybody. Okay, there's a lot of fear right now about the coronavirus, and a lot of people don't know where to turn to get advice. So I am turning to my friend, Dr. Jo Herzog. She's a doctor, married to a doctor. She's getting a lot of information that we're not privy to, and she's also got a whole lot of practical wisdom. So Jo, thank you for being here.
The first thing we need to do is to avoid being infected. So we don't want to run out and go shopping every day. We're going to avoid crowded places and places where other people are in your face. This virus is not transmitted like the measles is. For example, the measles, if
was airborne.
I have the measles and I go in an elevator and I step out and you walk in, you're very likely to catch the measles.
Because
this
it
is
stays
not
in the
like
air.
that. Right.
Okay.
This is droplet spread, and
Droplet
I probably
spread.
need to like sneeze on you, cough on you, touch you, or me touch your laptop, and then you touch it and you rub your eye or stick your finger in your mouth or stick it up your nose, any mucous membrane. So it is spread on surfaces, and it is spread person to person. So we need clean surfaces, and we need to stay away from persons.
Okay, so Jo, you said if we have to go out, keep a distance 3 to 6 feet, because if someone sneezes, it's droplet borne.
Keep a healthy distance. If you have to go someplace, keep a healthy distance. And if you don't have to go, don't go. Go to the store when you need things. Try to minimize your travels to places where you're going to be in contact with a lot of people. So the less people you contact, the less likely you are to get sick from them. When you're with people, you don't have to touch them. So you don't have to hug them even though you want to, and you don't have to shake your hands even though it's polite. Avoid hands and hugs. Give them an elbow pop. Give them a hey. Give them a hey, how are you? Don't have to touch them, and you don't have to breathe on them or have them breathe on you. It's just one more thing that you can do to protect yourself.
But you advised my husband, and you say you advise anyone to get a flu shot and a pneumonia shot. Tell us why. It never occurred to me.
We don't want to get sick with two things at once. You don't want to have the coronavirus and the flu. You don't want to have a super infection of a pneumonia. You don't want to get one thing on top of another. So our immune system is down, and we get a secondary infection, and the secondary infection might be what gets you. So anything you could avoid. So get a flu shot. More people are dying of the flu in this country than anything, as far as virally. And we still have all these people in this country that don't think that they should get a flu shot. Well, get a flu shot. And we are getting to the end probably of the flu season, but we're probably going to be seeing another flu season where we're still going to worry about this next year. So just get a flu shot. If it's age appropriate for you to have a pneumonia shot, or if you need a pneumonia vaccine because you have an immune problem or respiratory problems, asthma, whatever, if your doctor advises for you to get a pneumonia shot, get one. This is a time to not be slack about that. It's important to do that.
Well, and then Dr. Jo, Clorox actually has on their website the precautions for disinfecting surfaces. It is 1/2 cup of bleach to 1 gallon of water
for surfaces.
And could you give us just a few examples that you might see?
Your tables, your countertops, seats that you might sit in a public place.
But you said timing is important.
Okay, so yes, so you can't just wipe it on or wipe it off. It needs to sit for a certain amount of time, and I think Clorox company tells you 5 minutes. So time is important. So when you read instructions, when things say that they work as a disinfectant, you have to be aware of the time it takes. It doesn't necessarily mean that 1 second of contact is going to do it. Disinfectants work very well for this virus because it's encapsulated in an envelope. It's an envelope virus, and I assume that it probably just works by breaking up the envelope of the virus. So disinfectants are very good, and there are a lot of disinfectants that help. 70% alcohol or more. Clorox and several other disinfectants will help with this, so we want to use them. Of course, hand washing is the most important thing. 20 seconds, top of the hand, front of the hand, everywhere, the whole hand, not just this. It's not hand washing, it's all of everything. At least 20 seconds or as long as it takes to sing happy birthday twice. Use soap. And I would prefer that you have the double coverage of using soap and hot water. The most important things is washing your hands frequently, and don't stick them in your eyes or nose or mouth. So you can't always wash your hands. So if you are driving through somewhere to get some food for your kids and you want them to wash their hands, you don't have running water in your car. So you go to something like hand sanitizer. So those are things that we want to talk about today because they are flying off the shelves in the store, and every place doesn't have hand sanitizing, but we can make our own.
That's right. And we both have been at different stores today, and I had to go to 4 to get these. Well, 3 to get this, 4 to get alcohol. And Joe, you said 70% is the strength, the minimum strength.
Yeah, so I got 91% alcohol at Target because they had 70 and 91.
But my Target was out.
Right, so 70% is what we say is known to kill the virus. So we will be mixing it with aloe vera gel.
Okay, and I did have someone ask me where you get this. This is...
It's in the sunburn department, or you could get it in the baby department, depending on whether you're getting aloe vera gel to put on a baby or aloe vera gel for your sunburn. So even in the dollar stores with the sunglasses, it's not a disinfectant. It's the vehicle that we want to be able to put our alcohol in to make something that we might find pleasant to put on our hands.
So we're just using this to make it to make it where it will stay on our hands.
Right.
And then you also had a tip. So you're going to Chick-fil-A.
So we can make our own wipes. It is hard to find Clorox wipes now, or disinfectant wipes. They don't have to be Clorox. I'm not trying to brand anything, but
Bleach.
That's what people understand.
Yeah.
So if you don't want to buy the wipes, or if they're expensive and you can't afford them, you can make your own wipes by doing that formula.
This solution.
Right, and you can use it to spray. I would spray it on paper towels. I would fold my paper towels and put them in a baggie and a Ziploc bag and spray it on them and keep them in there. Or you can even put it back into a Clorox wipe bottle. So we know that a Clorox wipe bottle is safe to, or disinfectant wipe bottle is safe for Clorox to be in, because remember, you don't want to put, everything's not okay to put different chemicals in.
Well, Joe, could we also put this 1/2 cup of bleach to 1 gallon of water, mix that up and put it in a small spray bottle and spray, like if we're at a restaurant, just
don't spray your friends with their black pants, because you might be giving them black pants.
Yeah,
so
but you said it's 5 minutes.
You could spray it and just make sure that your bottle is one that won't.
Yeah,
I'm
like
not
a
positive that every bottle is okay to put that strength in. I know that the bleach bath solution that we use for patients, that's a quarter of a teaspoon in a gallon of water. We could put that in any kind of bottle, and we don't have trouble with that. But
if someone wants to take this in a spray bottle and spray, but it has to be
on the surface, let it sit
for
for 5 minutes, and don't leave it there on a chair what you're going to sit in, because if you sit in it, it could bleach your clothes. I'm not sure that it will, but it could.
So just wipe it up with anything.
So I would wipe it off with a diaper wipe, or something that's not necessarily antibacterial, but something that's a wipe, and let that dry, and then do that. You know, and if table, if you can put your elbows on it or whatever. But that you can do, or you can make a more dilute Clorox solution if you're going to be using it for wiping hands or something like that, or wiping a baby's bottom, whatever.
Okay. And then I do want to ask you as another thing, do we need to buy and wear masks?
No, unless you are wearing it so you don't get somebody else sick. If you're sick and you have a fever, you have a cough, you have short of breath, you should be wearing a mask so you don't get somebody else sick. But there is not any good proof that the common masks that we're buying, like in the store, like a little doctor mask, are going to prevent us from getting sick. Not those masks. There are masks that would protect you, but you're probably not going to be buying those. That's not the kind you're buying, and some of them have pretty significant restrictions to how long they work for, and you really need to know what you're using. So some of those respirator masks are only good for 8 hours.
Oh, wow.
They're not inexpensive.
Right.
So probably the best way for you to not catch it is not to be close enough to someone for them to spread it to you.
So basically, to round up your tips, but avoid being within 3 to 6 feet of anybody, really. Avoid hands and hugs. And yes, and then make your
washy.
Yes, washy, and then get your flu and pneumonia, if applicable, vaccines, and make the surface disinfectant out of a half a cup of bleach to a gallon of water, and use that for surfaces. Leave it on for 5 minutes, and then you can wipe it off after it dries. And then use hand sanitizer to supplement the most important thing, washing hands. 20 seconds, preferably with warm water, and always with soap. Is there anything else? You said just don't panic. And just,
I say don't panic, don't stop living.
But there have been things in the news that they say this will be like the pandemic of
1918, and I don't necessarily think that, even if this is just as contagious, I don't think it's going to demolish the amount of population. Thankfully, in the time of modern medicine, we have antibiotics for secondary infections. So if someone gets another infection on top of the virus, we have antibiotics for that. We have ventilators. We have a good number of ventilators. We have them in our hospitals, but we also have, I believe that the government has some that are even in storage for emergency use.
Oh, wow.
Some countries where there is socialized medicine do not have that. They have had to cut back what they have because they can't afford it. And in Great Britain, they have a limited number of ventilators now. And they're going to have to choose who. There will be boards where maybe 3 physicians will sit on the board and decide who's going to get treatment and who's not.
And that's what you get when you get socialism.
That's right. Thankfully, our country is affluent enough as far as our medical field goes that we should be able to take care of our patients unless something goes totally crazy, which hopefully we don't. So that's why we want to prevent spread.
Right.
We want to have our facilities available for those who really need it. And that's another important thing. If you think you have a virus, stay home. If you're just a little bit sick and you have fever of 100.5 and you have a little cough and you have a little cold and you're otherwise a healthy person and you are not short of breath and you're not really sick, don't run to the emergency room. People are going to get this virus. And kids are going to get it. But everyone doesn't have to go to the hospital. And everyone's not going to need to be tested for the virus. We're already seeing doctors calling the health department for
the
test kits. There are rules that we need to follow for who's going to be tested. Because we can't test everybody because we don't have enough test kits. So we need to save our facilities and what we have for those that are really going to need it. And
the
people
elderly
can't all start going crazy. Yeah, well, those that really get sick. Speaking of that, we didn't talk about that. Keep grandma home. Don't go to church if this starts coming
Watch
around.
online. That's great for online church.
Don't go to McDonald's or wherever where there's lots of people. Stay home. If you're likely to be one of the people that are more at risk, don't go any place where you don't have to go. So.
Well, I think this is so helpful, and I thank you so much.
Thank
you, and Joe, thank you.
Oh, pleasure.